So now you've submitted your medicine or dentistry application, it's time to start thinking about interviews. So if you're applying to medicine or dentistry, you're going to have either one or both of MMI or panel interviews. So I'm going to give you an up-to-date explanation of what those are, what to expect, and how to prepare for them so that you can put your best foot forward and get through that final hurdle when it comes. So the first one and easiest to grasp is the panel interview, which, as the name suggests, is a panel of 2 to 3 people. It lasts about 20 to 30 minutes, and it's generally quite an unstructured conversation where, although they will have an idea of what they want to ask you and kind of where they want to take the conversation, it's also very open to you taking the conversation wherever you kind of want to or can influence, or maybe accidentally even do, by the things that you say. So whereas the other format looks more at variety, this one allows for a little bit more depth. So they'll ask you questions about your personal statement, about your reasons for wanting to go into the subject, or maybe even about your understanding of some healthcare issues. They might ask you questions like, why do you want to study this subject? Or tell us about a challenge that you faced, and they'll probably discuss and probe a little bit further about that. Or tell us what you learned from your work experience. So then the MMI is a bit of a different beast. It stands for multiple mini interviews. So as the name suggests, it's several little interviews. So you do a little circuit of anything from about 6 to 10 stations, each circuit lasting anything from 5 to 8 minutes. And some of those stations might be a little rest station in between where you literally just sit and do nothing and gather your thoughts. So every station will be different, and it'll look at a different theme. So it'll be like communication, empathy, maybe some ethical scenarios, data interpretation. You might even get some role play, but each one is different, and they are also independent from one another. So if you don't do particularly well in one station, you can almost ignore it and move on to the next one, and everything starts again, and you can get a score for that. This means that if you don't do particularly well in one station, you can make up for it by doing well in the other ones. It kind of negates the issue that people have or worry about with panel interviews, whereby if you say one wrong thing, or if you kind of send the interview in a direction that you don't want it to, that whole interview is influenced by that. Whereas this, each one is its own independent thing. However, equally, that means that if you absolutely nail one of your MMI stations, that only counts for maximum score in that, and you still need to make sure that you do the same in all of the others. But obviously, it's the combined score that makes the overall decision as to whether you get offered a place or not. And the advantage and the design of the MMIs is that they reduce bias, so the interviewer only sees one part of it. But like I say, if that is the case, then that means that you need to nail every single one. So what are the key differences between the two? Well, the themes are exactly the same. They want to understand that you have the right motivations for going into the career, that you understand what you're letting yourself into, know the realities, and that you have the right traits that would make a good doctor or dentist. But they test them differently. So for example, if it's a question about, let's say, a difficult communication scenario, you might have a panel interview might ask about the ethical considerations and kind of go into depth of back and forth, and they might play devil's advocate, and they want to see that you can present the for and against both sides of the argument and come to a balanced conclusion and an opinion based on that. Whereas in the MMI, you might have the same thing, but it might be a breaking bad news scenario, and you'll have a role play where you actually have to talk with that person and go through that in a mimicking a real life scenario situation. So what's being tested is the same, but the delivery and the pacing are different. The next thing is, of course, how to prepare. Now, for the MMI, you want to simulate the pressure and the circuit and that kind of pace of going around and changing topics as much as possible. And I would advocate for getting some really good help with that. You could check out the FutureDoc program, where our interview training is amazing, but I would highly recommend that you join us before that so that you can get everything about the application sorted, so that all of it's on point. Because even when you get to interview, like how you've written your personal statement and all the things that have led up to that will dictate how well you do. But of course, training for that is really important. And on the FutureDoc program, we get people to, we do something called the interview hot seat, where it's like we really simulate the pressure, turn up the heat as much as possible, so that people are kind of used to that pressure cooker environment when it comes to the day. We do some in-person training as well, which again is just really good for building communication skills. So try and get that sort of practice that you can, so that you're feeling confident on the day. So for MMI, the way to prepare is to obviously know all of the information that you need to, but get used to kind of going between stations and quickly thinking and resetting between one subject and kind of putting that one out of your mind and moving on to the next. It's very similar to when you're seeing patients. Like, you might have a patient and it's maybe quite a stressful situation, there's high pressure, there's a lot going on, and then as soon as you leave that patient, you go and see the next one, you have to put that behind you and refocus on the new patient to give them your full attention. And that might be a very different scenario and ask you to switch the kind of the skills that you're performing or the type of task that you're having to do. So that's how it simulates real life as a doctor. For panel, it's more about structure and how you build frameworks around giving your answers so that they seem coherent. Here are some of the ones that I like, and I'd recommend that you do that to show that you've got a method to the way that you think and the way you structure your thoughts. One of the ones that I like for if you're telling a story is the situation, action, and reflection, but then also for ethical type questions, the 4 pillars is a really useful one. I do a video about that here, which is really useful. But it's really useful to get a lot of these frameworks under your belt, because the more frameworks that you have to fall back on, the less likely you are to freeze when you don't know the answer to a question or you're get a bit stumped by something that takes you aback. So look, if you check out the FutureDoc channel, we've got loads of stuff to help you through interview stuff. We have really good success with getting students into their chosen university. Also, on top of that, if you're watching this and you are either resitting your application or you haven't even started preparing your application yet, don't wait until interview to get help. It is more competitive than ever now, and the sooner you start, the sooner you get some help, the sooner you build that momentum with your application, the more likely you are to succeed. So if you want some help with getting into your chosen university, check out the FutureDoc program here, where we can help you write your own story. So thank you for watching, and I'll see you in the next video.